Namibia needs me and Namibia needs you. Welcome to the podcast that breaks down the current affairs and why it should matter to you. We chat about real impact, no fluff, no fillers. So let's get into it.
Morning, Janola.
Hi, Ethne, how are
Very
you?
well. We've got only two stories this morning.
Yes, very interesting stories, I must say. So the first one is on the teaching professions bill consultations that are currently underway, and the mental health cases as reported in the Kavango East region.
Great. So this new teachers bill was called for back in 2011 already.
Yeah.
And so finally, about 15 years later, we're getting into it. We're getting public consultations. The idea is to have better oversight, better regulation, better accountability for teachers, because we are seeing that there are underqualified teachers who aren't doing a good enough job, and there's no really real way of controlling and monitoring this. So we're going to set up a whole council to do so.
Yeah.
I have thoughts and feelings. What are yours, Janola?
All right, so Ethne, like you're saying, the attempt of the bill, once it's gazetted, is that there will be a teachers' council, similar to how we have a nurses' council, an engineers' council, a health professionals' council. So there will be a teachers' council. So you won't be allowed to be a teacher in Namibia unless you are registered, or you won't be qualified to teach unless you are registered with this particular council. So basically, my feeling, Ethne, is that there are a lot of issues of not enough classrooms, not enough schools, too many kids per classroom. Teacher to child ratio is already exaggerated in our country. So, as opposed to establishing new structures to regulate the profession, why not rather invest that money into building more schools?
Mhm.
That would be my personal feeling, you know?
Mhm. So we know that as a country, ever since independence, our founding father has been a big proponent of this.
Yeah.
We have had a big portion of our budget spent on education
Yeah.
annually. About double our regional partners, but we don't have about double the amount of human capital coming out the other side.
Yeah.
What is wrong? What are we spending it on? We see that we're spending 80% of that budget that goes to education on salaries. We're spending a very small percentage on infrastructure, a very small percentage on educational teaching support. So I'm wondering, I mean, if I'm already a struggling teacher, does it help me more to be a better teacher if I'm more regulated? Or does it help me to be more supported in other ways? Perhaps by having adequate classrooms, smaller classroom sizes, adequate teaching support, adequate training, ongoing
Resources, educational material like textbooks, more books for the learners, more printing paper, more pencils, and those things.
And now instead we're spending that money on a new building, new desks, new printers,
New stuff.
for a whole new council. New staff, new salaries.
Yeah.
Again, salaries that are going to take so much of our budget that we could be perhaps giving to our children in more productive ways. So get part of the conversation. These consultations started already in 15 September,
Yeah.
in the Karas region. They're coming to the Khomas region on the 17th of October.
Yeah.
Important to get a part of the conversation. Ask these important questions. Are we using the money that we have available, which is little enough already, in the best way possible to actually serve our children?
Yeah. Ethne, there was another story in light of that happened last week, where the Prime Minister, Honorable Elijah Ngurare, the Minister of Education, Honorable Sanet Steenkamp, met with the traditional leaders of the Ndama community. Like, I know some of us will remember that 2 weeks back, Joba Mupanda released a social media video of how a school was being run under a tree, where all the teachers, all the HODs, everyone had all their, like, the structures were basically under a tree. And upon following up and researching on this story, we began to understand, also looking at the parliamentary reports, that this school was actually operating illegally. The teachers were never officially sanctioned by government. They are not government employees, but they teach like the learners every day, came to school every day, similar to how a government school operates. That's how they would be operating, with an attempt to force government to formalize them. And now the plea from the teachers and the parents was that even though a new school was recently opened, there were too many kids in the school, and it was so far from the community. So last week, the Prime Minister and the Minister of Education met with the traditional authority leaders and the supposed school management there, so that they can see how to mitigate the situation, because the school actually is still ongoing. Like, these kids are still being taught illegally, if you can call it, under a tree.
Mm.
But there were no actual
Well, no
structures to
crimes are being committed, so I wouldn't say
Yeah.
it's illegal. It's
Yes.
just it's not formally acknowledged.
So why or not rather, Ethne, the ministry invest money in building a school for that community,
You know,
so
because
kids
there
don't walk
isn't
20
enough money.
kilometers?
Look at
Yeah.
all of the kids being killed on the roads because there isn't enough financial support
Yeah.
to keep them safe when they leave the school. So there's so much need. And when there is so much need, given so little resources, my instinct would be to make the system more agile, not more regulated.
Yeah.
And
Yes.
less able to respond
Yes.
to needs.
Yes.
Which is not to say that we want disqualified or underqualified
Teachers. Yeah.
but perhaps that is what is needed. At least support those who are willing to teach in
Exactly.
ways to get them more qualified rather than get them more excluded.
Yes.
Get them more included. You'd be more responsive, be more agile.
Yeah, my feeling is that in terms of level of priority, it is more important to build a new school to accommodate kids so that 7, 8-year-olds that start grade 0, grade 1 don't get to walk 20 kilometers for their education. So for me, it's more important that the ministry focuses on infrastructure, resource provision, and maybe strengthening the efforts of teachers as opposed to starting a whole new council with new staff members.
I mean, but
Yeah.
before we pretend to be experts on this, let's
Yeah.
ask for the data that informs our policies.
Yeah.
Based on what data are we making these decisions? Do we know that greater regulation gives massive returns in education, or or have we learned from other countries that greater agility and greater support and training delivers greater results when it comes to our children? So let's ask the questions that require our policy decisions to be made based on sound data.
This podcast is designed for engaged citizens, curious minds, and anyone who just wants to get a better understanding of what's going on in Namibia. If that sounds like you, subscribe.
Let's
Yes.
move on to the next topic, which is about suicide. So
Yeah.
we have this article that just announces broadly that about 4,500 mental health cases were reported in Kavango East. Immediately, I go on to a rant with Janola.
Yeah.
Because I've picked up this habit in Namibian media where we just give a number
Yeah.
and then we're like, that means something. What does that number mean?
Yeah.
Compared to which
So-
general population, compared to which previous years, none of that information is available. But we're supposed to take the number of 4,500 as though it means something.
Yeah.
So I went and I did the work and I was like, okay, what is the total population of Kavango East? Okay, 4,500 is about 2% of that
Of the total
that
population, yeah.
Now I've got a meaningful number. Now I can go, okay, what is the a global average of
yeah.
mental health cases in any region or any country? Oh, it's 12 to 13%. So 2% is extremely low. It would indicate a robust,
Yes, a healthy society, yeah.
mental health situation in the Kavango East. But it's given to us as a cause for great alarm because it's an increase from previous years. But then when I go look for previous data,
Yeah.
nothing to be found. So that's my little rant, Janola.
Yeah.
This need for data literacy amongst us.
Especially even when it comes to mental health issues, because I know there are so many instruments in Namibia to help young people through mental health challenges. I know from the top of my head, Geluk Psychologists, Be Free, the Multipurpose Youth Center in Katutura. I know organizations like Childline, Lifeline have these instruments available to help curb mental health challenges. But really, in terms of how data is presented, like for instance, this story actually culminates from an event that took place in Rundu over the course of last week that was titled Strong Minds, Strong Men, Breaking the Silence in Rundu. And this event was basically organized to create mental health awareness and to lay a better foundation for particularly the boy child to face life with a more positive mindset. Now, already that is all on the assumption that the boy child suffers from mental health issues. But we generally like to see more information in terms of where are those premises drawn from? Where were those conclusions coming from in terms of why specifically just the boy child? Is it not a general issue amongst the population? Do women also not suffer from depression? I think that is a question which is where Ethne is saying the data is lacking, which is true. We need the data so that we can understand where to basically steer our efforts. Yeah.
And this is why this access to information call amongst all civil society organizations recently is so important, because we don't have access to the information we need to say meaningful things about any of this.
Yeah.
We do know that Namibia has one of the highest suicide rates in the world, and we do know that most of the people who commit suicide are men, but that leaves out an important caveat,
Yeah.
that an equal number, if not a greater number, of women attempt suicide.
Yeah.
The methods they choose to commit suicide are often
less
violent than
yeah.
the methods chosen by men. And so they don't as often end up harming themselves fatally in the attempt of suicide as men do. So that would show that men are not more depressed than women, because the underlying cause of suicide or attempts of suicide is depression.
Yeah.
So an equal amount of men and women are suffering, if not more women than men. Why the focus on the boy child? Perhaps a misunderstanding of that data. Perhaps we see more men committing suicide and therefore assume that they are more suicidal and more depressed. Actually, the data does not support that.
Yeah.
What we do know is men do have poorer help-seeking behavior. So women are more inclined to seek support from friends, family, and even healthcare workers than men are, because of stigma around manliness not being associated with needing help.
Yeah.
What a horrible thing. What a silly thing that we really need to debunk. But also, I think an important part of this conversation needs to be the amount of access we have to healthcare. So if we are saying, okay, there's an alarming amount of mental illness in the Kavango East, but actually the data we have shows that, wow, very few people
yeah.
are actually reporting anything. Is that because of a lack of access? Is that because of a large rural population that doesn't have the means to travel long distances and take the time to travel long distances to go to healthcare facilities, and then also cross a stigma barrier to get there?
Yeah.
So those are all things that I think it's important to mention. The amount of psychiatrists, psychologists, mental health care workers in Namibia are far below the World Health Organization recommendations for the population. And that doesn't even take into account how vast our country is and how thin spread our population is. In a more dense situation, the recommendation of healthcare providers would be higher. But in our vast country, it would be even higher.
Yeah.
So we're very understaffed. We've got way too few psychologists, psychiatrists, social workers, and healthcare workers. I wish we could put money that we're putting into defense and police and the mechanisms that need to tidy up when harm has already occurred into preventative measures like psychiatrists, psychologists,
yes,
and
exactly.
workers, social workers. It would prevent a lot of crime happening.
Yeah. My feeling, Ethne, is that we first of all need to, as a country, have the data so that we can know where best can we steer our resources. And once that is done, I think another area where the media is failing is also effective reporting, in the sense that when you say something like 4,992 in reference to what, or because it even just says mental health issues. And that is very,
mental
very
health cases.
Yeah. So that is very, very broad, So my feeling is that we also need a bit more accuracy from our media reporters so that we can speak to our people well. But very, very important is that we know that mental health is an issue. And even as a project, we are aware. Maybe the depth we don't know because the data is lacking. But please, what we will do is we'll put as many of the resources and or toll-free numbers in our description of this podcast, so that if you are challenging or know someone going through any such mental health challenges, you can get all the numbers, as many as we could find in the description.
There's a lifeline toll-free number that everyone must reach out to.
Yeah, no, we'll put it in our description. We'll even put some links to the Khalek website in case you need a telephonic psychologist, things like that.
Absolutely. And whenever you hear any calls for advocacy or pushing around the implementation of the Access to Information Bill, get behind it. These are the types of things that it can help us solve.
Yeah. All right.
Thanks for another great discussion, Janelle.
Thank you, Ethne.
Cheers.
Bye. Please subscribe, join the conversation as we explore different stories that are currently happening in our country.